If you're an athlete dealing with elbow pain, there's a few things that we have to take in consideration when we're looking at elbow pain. One, the medial epicondyle is predicated on the static position of the shoulder. In our daily life, we're mostly preset into internal rotation with the shoulders, meaning there's going to be a lot more rotational torque happening at the medial epicondyle, along with, when we hit layback, a passive range of motion, which is where peak stress happens at that end range, and you're really relying on passive connective tissue. However, when we're having elbow pain, we have to ask the question, why are we having elbow pain? Why is the force being receptive towards it? Now we got to look up the chain. We got to look at the shoulder, right? Well, what dictates and functions the shoulder overhead? We got to look at the scapula, right? The scapula is a floating bone on top of that rib cage, and the way it's positioned on the rib cage is going to play a huge role, because we need good, what is known as scapular humeral rhythm, or upper rotation of that scap, along with posterior tilt when we hit layback, to reduce less local external rotation from that glenohumeral head. So if the shoulder's getting all messed up and it's not functioning properly right overhead, you're going to start to see the arm start to drop, and then you're going to start to see the elbow push in front, wrist is more supinated, and it's going to start pushing more in front of that trunk, and that's going to expose that medial epicondyle, that gap where that UCL lies, a lot longer throughout the delivery. So again, if we're having elbow pain, we got to look up the chain and also down below the chain, looking at the entire kinetic chain to optimize and maximize your performance, and also to offset stress in that elbow.